Welcome to ICU Primary Prepcast.
Hi, I'm Maddie.
Hi, I'm Swapnil, and welcome to yet another primary snippet. Now, before we dive into today's primary snippet, there's a good news for everyone. As promised to Maddie, the website for critical care education is up and running again, and all the show notes can be accessed on the website. So, thanks to Maddie.
No, that was your work, but thank you for doing it because we were getting a few inquiries about what had happened. So
that's right. So thanks for reminding me last time, and the task has been completed. So good job.
Yay, well done.
Thank you. So let's dive into today's snippet. So we are going to talk about the sympathetic nervous system. So can you please outline the anatomy of sympathetic nervous system, particularly focusing on the origin, fiber types, their course, and the receptors and neurotransmitters involved in the functioning of sympathetic nervous system?
Sure. So I think it's good now. I think a lot of the questions seem to be more targeted, or more they give you more of a structure for your answer, which is easier in terms of trying to study for it. But thinking about the sympathetic nervous system, in terms of its origin, it originates from preganglionic neurons in the grey matter of the lateral horn of the spinal cord between T1 to L2. Some sources say up to L3, but most say T1 to L2. In terms of the fibre type and their courses, so there's different fibre types. There's short preganglionic myelinated B fibres. There's a sympathetic trunk itself, and then there's some long postganglionic unmyelinated C fibres. So thinking about the short preganglionic myelinated B fibres, they exit the spinal cord by the corresponding ventral nerve root, along with axons of the alpha and gamma motor neurons. And they pass into the spinal nerves, but then quickly separate from them by the white rami communicantes to enter the sympathetic chain. And when they enter the sympathetic chain, they have three main pathways that they can follow. So in the first, they might synapse with postganglionic neurons within the sympathetic ganglion at the same level of the spinal cord. They can either ascend or descend within the sympathetic chain to synapse with postganglionic neurons at a higher or a lower level. So the fibres from T1 to T5 often ascend, and those from T5 to L2 often descend. But that's not a hard and fast rule. And then the final thing that they can do is pass through the sympathetic chain without synapsing at all. And these are often those at the lower levels, so from T5 onward. And then these go on to innervate the abdominal and pelvic viscera. So the fibres that pass through the sympathetic chain without synapsing, they can combine with fibres from other levels and exit the trunk as splanchnic nerves. These include the greater splanchnic, the lesser splanchnic, the least splanchnic, lumbar splanchnic, and the sacral splanchnic nerves. These then synapse on a prevertebral ganglia, which are close to the viscera and surround the branches of the aorta. The prevertebral ganglia include the celiac, the aortico-renal, which is sometimes included within the celiac, depending on the source you read, the supramesenteric and the inferior mesenteric ganglia. So you can kind of think of it as the major abdominal roots or branches of the aorta. They supply the abdominopelvic organs, except for the adrenal glands. And then some preganglionic neurons also synapse directly on the adrenal gland. So these are different. These don't actually have postganglionic nerves. Then in terms of the sympathetic trunk itself, these are a pair of ganglionic nerve bundles that run on either side of the vertebral columns, and they extend from the base of the skull right down to the coccyx. And these ganglia are joined to spinal nerves by connecting nerves, and these are termed the white and grey rami communicantes. The sympathetic trunk consists of four major regions: the cervical, thoracic, lumbar, and sacral. So the cervical is three ganglia, the superior, middle, and inferior, but the inferior cervical ganglion is often fused with the first thoracic ganglion, which forms the stellate ganglion. And this is present in about 80% of people. And clinically, you might hear of that in terms of people doing a stellate ganglion block in anaesthetics. In terms of the thoracic region of the sympathetic trunk, this consists of 11 or 12 ganglia. The lumbar is 4, and the sacral is also 4. There's also an unpaired coccygeal ganglion. And then finally, the long postganglionic unmyelinated C fibres originate in the sympathetic trunk or prevertebral ganglia, and they travel to the target organs as distinct nerves or within autonomic plexi. Now, when we think about the receptors and neurotransmitters involved, as we've talked about, there are the preganglionic and then the postganglionic nerves. So the preganglionic nerves release acetylcholine and they activate nicotinic receptors postsynaptically. On target organs and vessels, the postganglionic nerves release noradrenaline and these act on alpha and beta receptors. The exceptions to this preganglionic versus postganglionic kind of rule for the sympathetic system is the adrenal medulla. So this is to be considered like a modified sympathetic ganglion. So for the adrenal medulla, the preganglionic fibers synapse directly in the adrenal medulla. So they've already, as we talked about, passed through the sympathetic trunk and the prevertebral ganglion without synapsing. These preganglionic fibers release acetylcholine. This binds to nicotinic acetylcholine receptors on chromaffin cells in the adrenal medulla and triggers the release of adrenaline, which makes up about 80%, and noradrenaline, which makes up about 20% of the substance released into the bloodstream. So even though there's no postganglionic nerve, it still releases catecholamines. And then the sweat glands and erector pili muscles is the other exception, where acetylcholine is released and activates muscarinic receptors. This is all quite complex to think about verbally. Some of the diagrams can be quite helpful in the anatomy books, and I think there's one also within Ganong Medical Physiology.
Yeah, that's right. The question have been changed over the period of time. Initially started with autonomic nervous system and now is going into specifics of one system, that is sympathetic or parasympathetic nervous system. So clearly having an in-depth understanding of each system is useful. The question have also been asked around the cranial nerves like vagus nerve and its role. So I guess the whole autonomic nervous system is a very significant component of the primary syllabus. So make sure that you have comprehensive understanding. And I think drawing the diagrams, especially with anatomy of sympathetic nervous system, is quite useful. And then explaining those receptors and their functioning using, again, diagrams will be quite useful. Even it sounds like it's a small part of the autonomic nervous system, is actually quite a lot of things to write for 10 marks in 10 minutes. So I think the more you practice these diagrams, that makes things very helpful. So thanks, Maddie. So that's the end of our today's podcast. We'll be back with another snippet next time. Till then, goodbye and have a nice time.
Thanks for listening and see you next time.